And it's now day 5 of the massive nurses' strike impacting the 5 boroughs, and talks are moving to a new level.
Yeah, the first talks since the walkout began really wrapped up late last night. In just a few hours, negotiations resume in Washington Heights, where nurses will picket despite those freezing temperatures.
All 3 hospital systems are set to return to the table this morning, with a federal mediator stepping in to help. Pix 11's Kalarama joining us live outside New York Presbyterian with the very latest. Good morning, Kala.
Good morning. I just want to update you guys. That is what we originally thought, that federal mediator would step in once again today and meet with the 3 hospitals. But there's some conflicting information. We have the night shift nurses who told us that would happen. The morning shift who's come in says the latest update now is that the hospitals have not agreed to come back to the table after such a late night, 5 hours of negotiations. You can see behind me that they've gathered once again, ready to hit the picket lines and reorganize, a little bit feeling defeated because they thought having the 5 hours of negotiating would get them somewhere. They said they certainly hoped they would return back to the table today, and with no response yet from the hospital on what time that would start or if they're even coming back to the table, it is a little frustrating. And they said that, their sticking points have remained the same. The nurses continue to be asking for health care and pension benefits to stay on the table, safe staffing numbers, and a pay raise. But thus far, the hospitals have said all of that is out of reach. Mount Sinai even saying that would cost $1.3 billion over the next year, and they are now prepared to pay visiting nurses through all of next week. That means this strike is going on longer than what we saw in 2023. Now, the New York State nurses have denied any claims of harassing the nurses that have decided to come to work, as Mount Sinai hospitals have said 20% of their nurses in the union have remained on the job. But listen.
The New York State Nurses Association has been aggressively harassing and intimidating Mount Sinai's nurses who have chosen to come to work. I'm sorry that this is happening to you. Over the past few years, we've done a lot to address pandemic-related burnout, to make sure that the workplace is safe, and to recruit and retain the next generation of nurses.
We had nurses come and tell their stories about what staffing is like on their unit, and the response from management was, we are okay with where we're at in terms of staffing. We don't need to improve anywhere. We want to get a deal done, or we want to get the contract negotiated and finished in a fair way. We're hopeful for management to come to the table.
Meanwhile, these nurses are telling me they were hoping that a federal mediator would help, and that they're hoping that all 3 hospitals will come back to the table again. We're waiting for an answer from those hospitals. I did hear some communication from Mount Sinai, who said, we're actually wondering the same. We'll get back to you as soon as we have an answer. Hopefully I'll update you in just a little bit this morning. We're live from New York Presbyterian. I'm Kalarama, Pix 11 News.